to show you that everything I told you is still the same, even if in very difficult cases. Angèle was doing riding a bicycle, and she fell down on the base of a bridge, and she broke the 3 anterior teeth, broke the jawbone, you see, the maxilla bone. No labial plate is there. She lost everything. It is extremely difficult case, and although she seems to be happy, she's not happy at all, because look at that. She has no more bone. And we think that this could have been a case for immediate loading. Not immediate, for autogenous bone graft, excuse me. But can you imagine this little patient, 19 years old, never been to a dentist, don't know what is dentistry, fell down, and suddenly she has no teeth, and you tell her you need to go to take bone from the chin and or from the hip or whatever. It's a dramatic change. And I told her this time I was trusting this material. Say, we can try to use this new biomaterial. I'm not sure that we can gain so much, but in case we would have gained something and maybe be able to add autogenous bone graft if needed. Then she accepted my idea, because look at that. She lost so much bone. You can see here that she lost vertically, horizontally, and look how much. So it's nice as a beautiful temporary restoration. But can you imagine a young patient, 19 years old, having all her life with those gray abutment emerging from the soft tissue and having pink porcelain or acrylic? If we can avoid this, why not? And she was such a nice little girl that I said I would have to do that. So when we are trying to use this new sticky bone, so we're going to reflect the flap, okay, like this, and you can see, you remember on the x-rays that we lost so much, and reflect the flap as much as we can to be able to play with the loss of tissue, like this. And look how much we lost. Incredibly amount of bone, nothing left. So we take the burr to give freedom to the flap, and we measure 15 millimeters there, 18 millimeter vertically, and 4 to 5 millimeter thickness. So I decided to play with the biomaterial, as you have seen, and these are the X-rays, the pictures to show you how much we lost. And this is the GTO we added. Look, we added 15 millimeters and 18 in vertically, and 4, which is huge. But the problem is there's so much biomaterial. Will this material have blood supply enough blood supply to have a living bone within a few months? The answer is yes. Because when I came back, first of all, you take the X-ray, you see the plates of the soft tissue here, because we added as much as we could. And you can see on the X-ray, the graft, which is there. But more important is to see what will happen when we enter. So we reflect the flap again. You see the tissue becomes better. We not have gained enough, but we gained a lot. And we decided that was good enough to be able to place 2 implants in this situation. And we're going to measure the initial stability, not to think about going to immediate loading or not, because I didn't know what would be if this bone would be mature enough to load it, because there is a huge part. So it's not because it's mechanically stable that we can maybe go to immediate loading. We need to be on the safe side. So we decided to place those 2 implants. 3 couldn't place, so we'll have a pontic there. Okay. And after placing the implants, we're going to measure where this implant will be stable into this bone. Because again, as with this little patient from the beginning, we started from nothing. So we're going to place our cell to see if we are in a good clinical situation or not. Look at the value, green. What does it mean? Very favorable. There's one, green again, over 70. Both cases. So we got 72 and 74 on those two implants. But we're not going to immediate loading because we need to add more. The good thing with this material is that you can add, but we know that we are in the good situation. So I added a layer of GTO labially. Then I'm going to do as a saddle and add another layer above it to gain vertically on the anterior implant ridge. Okay, compact like this. Okay, and we'll place another one to gain even more. So you see, we can work as in plastic surgery, layers by layers to add tissue, and we cannot gain everything in such a case every time. Look at the picture we could get before placing the implant at 3.5 months. Amazing. And this amazing situation was confirmed by the hostel. Like this. So we close and we re-entry. These are the pictures to show you what we did. Those two implants are placed into bone again, where they remember there was nothing left. Good value. We added vertically. And when we placed those implants, we did a second stage surgery. The value were 76 and 74. So it means the value we got when we placed the implants not only remained, but became higher. So we are on the safe side. And in such a difficult case like this, it's extremely interesting and important to know where you are and where you can go. So you can see the soft tissue there. Look at the tissue we could get, and it's not plastic or porcelain acrylic. You see porcelain soft tissue. This is real living tissue. So that was the case before and the case after. And the patient, which is extremely happy, like this. Look how happy she is. Now she's going to Paris. She's going to work in the cinema world. So I'm really proud and glad to have been able to treat her. And the father, who is now a patient, came 2-3 weeks ago and sent me a picture of her daughter now. She became a bigger girl, extremely happy and smiling. You see, with no problem, she can have a glass of white wine and say, cheers, thank you very much. And I'm really glad about that.